Have you ever had one of those skin rashes? You know the one. Maybe an itchy foot that just will not go away no matter what cream you try. It's so common, and it can be incredibly frustrating. Well, it turns out there's a really specific reason why those over-the-counter treatments sometimes just don't work. So we're going to get into exactly why that happens, and what your other options really are. A lot of the time, it all starts with something that looks just like this. That peeling, super itchy skin between your toes. Classic athlete's foot. This is a perfect example of what doctors call a cutaneous mycosis, which is really just a fancy way of saying a fungal infection living on the surface of your skin. Now, the main culprits behind these infections are a group of fungi called dermatophytes. And here's the interesting part. Their food source is keratin. And what's made of keratin? Our skin, our hair, and our nails. So it makes perfect sense that this is exactly where these annoying infections love to set up shop. Okay, so let's get to the bottom of that stubborn fungal infection. It's time to meet the microscopic troublemakers that are really behind things like ringworm, jock itch, and those nail infections that seem to last forever. You know, we tend to lump all skin fungi together, but there are actually a few different major types causing all the trouble. You've got the dermatophytes, which cause tinea. You probably know it as ringworm. Then there's malassezia, which is the fungus behind things like dandruff, and of course, candida, which causes yeast infections. The key thing to remember is that you need to know which fungus you're dealing with. So you get an itch. Your first thought is probably to run to the pharmacy and grab a cream, right? But what happens when the cream just doesn't cut it? Let's talk about why that first line of defense can totally fail. And let's be clear, starting with a topical agent, a cream or an ointment, is the right move. It's totally the standard, logical first step. For most simple infections, it works great, it has fewer side effects, and it's way less expensive. So this leads us to the big question, doesn't it? If creams are the go-to, why do so many of us find that an infection just keeps coming back, or maybe never even goes away in the first place? Well, it really boils down to a few key things. First off, compliance. It's just hard to remember to put a cream on every single day, and it's even harder to keep doing it once the itching stops, even though the fungus is definitely still there. Plus, let's be real, trying to get cream to work on your scalp or under a nail, it's almost impossible. And this shows you exactly what I mean. A cream might be able to knock out the athlete's foot on the left, but for a really deep-seated nail fungus like the one you see on the right, a cream just can't get in there deep enough to actually cure it. It's not going to be enough. So here's the bottom line. When a fungus gets into your nails, or into your hair, or if the rash is just everywhere, it's probably time to think about a totally different and much more powerful game plan. And that brings us to the next level of treatment. This is where we call in the big guns, systemic therapy. We're talking about taking a pill, an oral medication that fights the infection from the inside out. It goes through your whole system to attack the fungus everywhere. This is a great little side-by-side. Creams are great because they have fewer side effects. But taking a pill, the compliance is so much better, it's just easier to remember, and it treats the infection everywhere at once. The trade-offs, of course, are a bigger chance of side effects, and yeah, it usually costs more. So what exactly are these oral medications? Come on, let's take a quick look at the main antifungal drugs that your doctor has in their toolkit to finally knock out these stubborn infections. This chart is a fantastic cheat sheet. So terbinafine, that's the #1 choice for nail fungus. Griseofulvin is a classic, often used for scalp infections, especially in kids. Then you have the azoles, like fluconazole, which are great because they work on a wide range of fungi. And ketoconazole, it's more of a backup choice these days because of a small risk of liver issues. Each one has a very specific target. Now this is where it gets really interesting. Look how long the treatments take. If we use terbinafine as our example, a skin infection might be gone in a few weeks. But look at the nails, 6 weeks for fingernails, and a full 12 weeks. That's 3 months for toenails. So why on earth does it take so long for toenails? Well, it's pretty simple. It's all about blood supply. The medicine has to travel through your blood to get to the fungus, and our toes just don't get a lot of blood flow compared to other parts of our bodies, especially as we get older. So it takes way longer for enough medicine to build up and kill the infection. Now, because these oral drugs are pretty serious, a doctor isn't just going to guess. And that brings us to 2 incredibly important steps: getting a proper diagnosis before you start treatment, and then focusing on prevention after you're cured. I really like this quote because it's so blunt. It says it is mandatory to confirm the infection is there. You have to be absolutely sure what you're treating because a lot of other skin problems can look exactly like a fungal infection, but they won't respond to these drugs. And the process to confirm it is actually pretty simple. It starts with a good look from your doctor. Then they'll take a tiny sample, like a little skin scraping or a piece of nail clipping. That sample goes off to a lab where they either look at it under a microscope or they try to grow the fungus in a dish. That's how you know for sure.
Okay, so you go through months of treatment, you're finally cured, but the fight might not be over. Check out this number, 25%. That is the potential chance that your nail fungus will come back, even after you've successfully treated it. This is why prevention is everything.
So, how do you stop it from coming back? It's all about good habits, really. Don't share things like shoes or towels, wear sandals in public showers and pools, and keep your feet dry. Change your socks, alternate your shoes. Some doctors even suggest using a topical cream once a week just to keep the fungus away for good.
And this is a perfect example of why getting that diagnosis right from the very beginning is so critical. This is a condition called tinea incognito. It's what happens when you treat a fungal infection with the wrong thing, like a steroid cream for eczema. The cream might reduce the redness, but it lets the fungus grow unchecked, making it way, way worse in the long run. So the next time you have a rash that just won't quit, remember all this. A proper diagnosis is non-negotiable. And for those really deep, stubborn infections, there are powerful options that go way beyond that tube of cream. It all kind of leads to this one final question, right? Your skin is your body's first line of defense. Are you actually listening to what it's trying to tell you?